The next part of the assessment after head and face is going to be the eye assessment. So again, we're going to start with inspection. You're going to be inspecting the eyebrows, the eyelids, the conjunctiva, which you can kind of pull down the eye and look at the conjunctiva. And you're looking for pallor, color, redness, irritation, things like that. So here I'm going to check her conjunctiva. You're going to be assessing the sclera for color, checking the eyes for size, shape, symmetry, color, eyebrow hair distribution, and lesions. You're going to assess the 6 cardinal fields of gaze and cranial nerve number 2, which is the optic nerve. You can assess for cranial nerve number 2 just by picking up a piece of paper or having the patient read something. So I had Professor Bird here just read a section off of this brochure, and she did that correctly. So cranial nerve number 2 is intact. That's the optic nerve. And then I'm going to assess the 6 cardinal fields of gaze. So this is going to be optic nerve 3, 4, and 6. And then next you can get your pen light and check the 6 cardinal fields of gaze. I realize this is not a pen light, but you can use anything as long as they follow your pen light with just their eyes. So you want to instruct them to not follow with their head, only their eyes, and do the 6 cardinal fields of gaze. You do want to go slowly and return back to the center every time so your patient doesn't get dizzy. And you're looking for a nystagmus, and you're looking to make sure they can follow. And then you want to check for perla, which is pupils equal, round, reactive to light, and accommodation. When you're looking at size, you can look at the size of the pupil, look at the size bilaterally, and gauge what size it is based on. A lot of your pen lights have the pupil size gauge that you can relate it to. But here Professor Bird's I said they were a 3 bilaterally. I said 3 plus, but they're not a 3 plus, they're just 3s. And the size is based in millimeters. And then also you're using here a pen light. You're checking for how reactive the pupils are to light. So you're going to warn the patient, I have a bright light, I'm going to shine it in your eye. I'm going to do one eye at a time. And when you shine it to the pupil, you want to watch for pupil constriction. So the pupils should constrict. So just imagine here, I'm holding a pen light, shine it in the eye and look for constriction. You can do it a couple times, you just don't want to hold the light there too long. When you shine the pen light in one eye and it constricts, that's a normal finding, but you're also going to look in the other eye, the one you're not shining the light into, and that should constrict as well, and that's called consensual reaction. You can do it a couple times if you really want to make sure that it's working correctly. So I would say the reaction was brisk because her pupils constricted very quickly. That's a brisk reaction. And then with accommodation, next with perla, you're going to check for accommodation, and this is where we're checking to make sure that the pupils dilate when looking at a distant object. So when Professor Bird looks closely at the pen that I was holding, her pupils should be pretty constricted. And then I'm going to have her look at a distant wall or an object on the wall, and you'll notice that the pupils should dilate. Lastly, for the eyes, you're going to palpate. You're going to be palpating the eyelids, the lacrimal or the tear ducts, palpating the eyes for tenderness, puffiness, and any drainage.